I'm Amy Goodman with Juan Gonzalez. It's the morning after. It's the morning after the Supreme Court upheld President Obama's Affordable Care Act. We are joined by Jody Jacobson of RH Reality Check and Wendell Potter, insurance industry whistleblower, Dr. Oliver Fine, past president of Physicians for National Health Care Program. I wanted to turn back to Jody to ask about the issue of the right-wing attacks on health care, especially around women. There was a lot of discussion about abortion outside the Supreme Court with the hundreds of people that were there. How does this law impact women's health care?
Well, on the whole, I mean, first of all, I'm unequivocally in agreement with the issue of the single payer piece, and that we should be striving toward that. And this is a first step forward toward what we really need. But for women, this law is without question a gain, because 45 million women have already received coverage of things like Pap smears and cervical cancer screening, breast cancer screening, other forms of reproductive health care without copay. There's already been an increase for women in access to all sorts of health care that they need because they are women. And what this law does is it removes gender discrimination in health care pricing. It enables women to get access to care. As of August, women will be able to get access to contraception without a copay or without deductibles, just like any other prescription that might be treated under their plans. So for women, on the whole, the law is a win. And while we have a lot further to go, there's no question it's beneficial for women. Of course, under the whole debate around the law, women lost access to insurance coverage for safe abortion care. And in many states, not surprisingly, many of the states that also sued the federal government about the health care law, state legislatures and governors are trying to take steps backward in denying women access to care. So I think it won't be unrelated when we see who's willing and not willing to, for example, expand Medicaid coverage, as to who's also trying to strip women of their reproductive health care. The state of Texas being one example where the state legislature has tried to both deny funding to Planned Parenthood clinics, even though they're not providing abortions, to diminish the amount of funding for public funding for contraceptive delivery and for Pap smears and breast exams. All of these things directly impact women, and all of these things are at the political core of some of the debates also around what the United States Conference of Catholic Bishops is continuing to contest about the law. They just don't want women to have access to reproductive health care.
Well, I'd also like to bring into the conversation Robin Lunge, Director of the Health Care Reform for the state of Vermont. In May, Vermont Governor Peter Shumlin signed a health care reform bill that will make Vermont the first state in the nation to offer single-payer health care beginning in 2017. The Vermont Patient Protection and Affordable Care Act aims to stem the rising cost of health care and provide universal coverage.
On Thursday, Governor Shumlin hailed the Supreme Court decision upholding the federal Affordable Care Act, but he said Vermont would probably be least impacted by it. Possibly the biggest effect of the federal law will be funds to help the state pay for its new health care system. Robin Lunge, welcome to Democracy Now! Explain the system you are putting in place in Vermont and how the ACA, this law, affects it.
Hi, thanks very much. Yes, so in Vermont, we're looking to move forward with a Vermont-style single-payer system, which will ensure that every Vermont resident has health care as a right and not a privilege. So in terms of the ACA, we are looking to move forward with a waiver from the ACA when that is available so that we can move to a single-payer system and not continue to operate a private insurance-based system.
And how did you accomplish this? And how do you feel about the single-payer activists who were deeply disappointed yesterday? They wanted some of them wanted the Affordable Care Act to fail because they felt it would create much greater impetus for Medicare for all. You know, just dropping the words over 65 from Medicare.
I certainly understand the disappointment of the single-payer advocates on the national level. In Vermont, we've had a long history of health care reform and a real priority of taking care of our citizens. So we're not interested in waiting for the nation to catch up with us. So for us, we are in a different position than a lot of other states.
Well, I'd like to bring in Ali Fine and ask you, Republican Senator Marco Rubio of Florida reacted to the Supreme Court's ruling on the health care law by saying it's effectively a middle-class tax increase.
A victory for the Obama administration means a middle-class tax increase, and that's exactly what this is. Let's be clear, the Supreme Court only rules on the constitutionality of things. They don't rule on whether it's a good idea or a bad idea. And I think after all the noise is done, I hope people back home fully understand what this means. And here's what this means. It is now unlawful for you not to buy health insurance. And if you don't buy it, you have an IRS problem. If you do not buy health insurance, the IRS is going to be on your back and chasing you. They're going to take away your refund. They're going to increase your fees. They're going to come after you. That's what this now means for millions of Americans is you don't have to buy health insurance, but if you don't, you're out of compliance and you have an IRS problem.
That was Senator Marco Rubio of Florida speaking on Fox News. Ali, Fine this issue now, which obviously will become a major issue in the upcoming election of the Republicans, that this is a huge, unprecedented tax increase of the federal government on the middle class.
Yeah, there is an element, frankly, of truth to that. The real benefit of a single-payer approach, right, is that we would move from our multi-payer, for-profit health insurance industry to a Medicare for all kind of program. Medicare has an overhead of only 3%. That means that 97% of all dollars collected by the Medicare program go to pay doctors, hospitals, and for prescription drugs. Private health insurance has an overhead of somewhere between 20 and 30%, which means that only 70 or 80% of the dollars collected in premiums go to pay for care. But that's only part of the story because, you know, then the providers, for instance, hospitals, have to have a staff to deal with all those companies. We compared Toronto General in Canada with the Mass General in Boston. 3 billers up in Toronto General, over 300 billers at the Mass General. One could save an enormous amount of money. And the same thing is true, frankly, in doctors' offices. We all need somebody there to deal with the denial of claims, the different prior approval guidelines that each company has. We have, frankly, a lot of waste in the healthcare system because of the private health insurance industry.
Robin Lunge in Vermont, head of healthcare reform. How did you beat the insurance industry in achieving this legislation for Vermont?
So in Vermont, I think we have a culture of taking care of each other, and so it's very important to Vermonters that everyone have coverage. And I think part of the way we involve the insurance companies is that currently in our state system, we contract out certain services. So we may continue to contract out certain services, so there would continue to be a role for one payer, and that could be an insurer, depending on how much they came in for a bid and how much they were willing to reduce administrative costs. So I think partially we were looking for ways to ensure that we got to the gold star, and that that there was a role for at least one payer.
Why didn't President Obama, Ali Fine, do a public option? And do you see, although many people now, like the Progressive Caucus said, if it wasn't passed, ACA, they would immediately push for Medicare for all. Do you see that momentum right now?
Well, I think there needs to be a grassroots movement that sees the value of moving in this direction, right? Frankly, the pain that we see and suffering that patients are going through in this present system, I think is going to generate a real movement among people. This could be the civil rights movement of the 21st century in this country. And so I see that kind of movement as being the thing that will lead us to, in fact, get to a universal coverage system, a single-payer Medicare for all kind of approach.
Yeah, I'd like to ask Wendell Potter, where do you see the insurance industry going from here now in terms of what you were a spokesman for Cigna for a while. You know the industry well. Where do you see the strategy of the industry now to maintain its goal of highest profitability possible now that the new system has been approved by the Supreme Court?
It'll have a couple of strategies. One will be to try to influence how the Affordable Care Act is implemented at the state level and to influence the regulation writing, which will continue. The other strategy will continue what it has been doing for decades, which is to define the single-payer movement in negative ways. And I was a part of that, and I know how successful it has been. And I agree with Dr. Fine. It would be wonderful if there could be a grassroots movement. But I've been observing the fact that has not been happening, has not taken root, if you will, and that is because the entrenched special interest, certainly the insurers, have spent an enormous amount of money to influence public opinion and to even call the Affordable Care Act a government takeover of health care. They know to communicate, you have to communicate to reach people emotionally, and they spend an enormous amount of money to misinform people. That will continue. And that is why, my sympathies are with the single-payer people, but they just really, really need to start thinking about this and working in a more strategic way and realizing that grassroots is important, but it absolutely is not the only way to get where we need to go. That's got to be the focus.
I want to thank you all very much. Wendell Potter, former spokesperson for Cigna, Robin Lunge, Director of Healthcare Reform for Vermont, Governor Peter Shumlin. Thank you very much to Oliver Fine.